Hi, welcome to our February Diabetes Support Group meeting. We will first start with a recap from our December meeting where Ethan spoke about medications and diabetes. During last meeting, we discussed some common medications, including how they work and also some potential side effects. These medications include metformin, sulfonylureas, SGLT2 inhibitors, glucagon-like peptide 1 receptor agonists, DPP4 inhibitors, and lastly, insulin. Ethan provided this graphic here to kind of show different areas that these medications can act, how in individuals with diabetes there can be less insulin than we need, so medications can act through different pathways to help with this. And then lastly, we went through the different types of insulin and showed how, dependent on the type of diabetes or the individual patient, different regimens may be more beneficial. If you have any questions about this information or would like to go back to review it, our video should still be posted on the SRHC Facebook page, and I encourage you to go back and watch that. For tonight's presentation, our guest speaker is Cassie Shields. She's a clinical pharmacist at Salina Family Healthcare Center. She's also a certified diabetes care and education specialist. She's very knowledgeable about the topic, and we feel very grateful to have her here to speak this evening.
Good evening, everybody. Thank you for watching this video, and I'm excited to be here and talk about this awesome topic for February, right? Valentine's Day. Let's talk about the heart, right? And know your diabetes. So what are we going to discuss? We're going to discuss what are the risks of diabetes and heart disease. What are those important lab values that your doctors always talk about, and you're like, I don't really understand what those mean. And how do we use those values to decrease your risk in heart disease and also have the impact of preventing heart disease in the future? All right, so we're starting it out. You just get up here, you start this video, and I'm already asking a question. So I promise they're not too hard. So first question is, how many people have diabetes in the US? I'll do a little tick, tick, tick. So roughly 29 million people, so 1 out of 10 people have diabetes, okay? But I think what's even more alarming is that actually 1 out of 3 people, or about 86 million people, have pre-diabetes. And I don't have this on the slide, but actually by 2030, about 1 out of 3 will have diabetes. So this is something that understanding how important heart health is to your diabetes can help maybe prevent some of these other aspects. Okay, question 2. People with diabetes are X likely to suffer from a heart attack or stroke. Of course, I already have it on here, and they're 2, 3, and 4 times likely. So if you said 5 times, sorry, that's not correct. So 2 to 4 times likely to suffer a heart attack or stroke. And on top of that, 20% of deaths from a heart attack are related to diabetes, and 13% of deaths from stroke are related to diabetes or pre-diabetes. All right, final question. Smoking increases your risk of heart disease and diabetes by what percent? 15, 25, 50, or 60? So if you really look at this, I find this astounding because it's actually 50%. So just think, quitting smoking or stopping smoking alone is going to decrease your risk of heart disease or developing heart disease over your lifetime. All right, so this is a visual of just looking at all the things we talked about with those questions. 2 to 3 times likely for heart disease, coronary stents, heart attacks. I mean, you obviously can see, you get the picture, right?
Take diabetes to heart, linking diabetes and cardiovascular disease. Meet Michelle. Michelle enjoys spending time with her family, and in her spare time, she loves to cook and catch up on her favorite shows. She also has diabetes. And like many people with diabetes, she doesn't know there's a link between diabetes and cardiovascular disease. Cardiovascular disease includes conditions such as heart disease and stroke. If you have diabetes, you're more likely to have risk factors associated with heart disease, including obesity, high blood pressure, or high cholesterol. These put you at risk for heart disease and stroke. Over time, high blood glucose from diabetes can damage your blood vessels and the nerves that control your heart. And adults with diabetes are nearly twice as likely to die from heart disease or stroke as people without diabetes. But there's good news for Michelle. She can take steps today to reduce her risk, and so can you. Here's what you can do to protect your heart. Manage your diabetes ABCs: A1C, blood pressure, and cholesterol levels. Ask your healthcare team what your goals should be. Develop or maintain healthy lifestyle habits and learn ways to manage stress. Take medicines as prescribed by your doctor. Stop smoking or using other tobacco products. With lifestyle changes and a treatment plan from her healthcare team, Michelle can look forward to living a healthy life, and someone's very happy about that. So take diabetes to heart. Visit niddk.nih.gov for more information on the link between diabetes and cardiovascular disease.
Who's at risk? First of all, a large waistline. So when we're talking about this is the midsection, right? This is the biggest part of that midsection area, 35 inches for women or more, and 40 inches for men. Also high triglycerides. What the heck are triglycerides? They're fat, okay? So basically, like Ethan talked about last month or in December, the last video, that when we have too much glucose, insulin's trying to get it out of the blood. And it's gonna move it to your muscles, your brain, your organs, and lastly, it goes to fat. So when our triglycerides are elevated, we're gonna have more fat on the body. Okay, and then also low HDL. Now this is, I call this the good stuff, right? This is the good cholesterol because HDL scavenges kind of the sticky stuff, so we get it out of the system. The lower that is, the less it can do its job of cleaning up your blood vessels, right? And then finally looking at higher blood pressure. We know that higher blood pressure increases your risk of heart attack and stroke. And then the obvious, blood glucose, anything above 100 starts telling us, hey, we're not moving sugar out like we're supposed to. And then finally, smoking, obviously, like we talked about. Some way you can calculate your risk is we like to look at what is the potential of you having a heart attack or stroke in a 10-year time frame. We know the biggest risk is between 50 and 60, and then 60 and 70 is a little less of a risk. So, you know, that 40 to 50 time frame is when we want to prevent these events happening later. So we take this risk tool, and you can go in and plug your numbers. It's from the American Cardiology Association, I think is where it's at. And then you can plug these numbers in. They are not 100% right, but it gives you an idea. And then you can read a little bit about it if you want, or go ask your healthcare provider what these numbers mean.
I did not know that heart disease was the #1 killer of people with diabetes. I knew there was a connection.
Diabetes is a major cause of heart disease. I know this from experience, having had a quadruple bypass.
I was not aware there was a link between heart disease and diabetes.
I was told by my healthcare team that diabetes will affect every part of your body, but especially high blood sugars will cause thickening in the arteries, which will lead to heart disease.
When I had open heart surgery and the doctors told me there was a connection between diabetes and heart disease.
I was in the hospital. I was diagnosed with a minor stroke, and then they also told me I had diabetes.
My doctor has recommended a regime of physical therapy, increasing exercise.
They told me what not to eat, what to eat, exercise, and try not to stress out.
That I walk every day, watch my food, maintain my blood sugar control, and take statin drugs.
A statin, and also metformin, and a little baby aspirin.
I monitor my food and exercise daily by going online every day and using an online application.
I eat regularly. I don't do a lot of snacks. I try to make sure that I take one portion at each meal.
Laying off of the candy, because I liked candy, I still do.
I have a better breakfast than I used to. I eat a lot of fruit in the morning.
No fried foods, a lot of fruit, a lot of healthier choices.
And lunchtime, there's a lot of green salad, a lot of fresh vegetables, and no meat. What I'd like people to know about diabetes and heart disease is that the diet and the lifestyle that leads to heart disease also creates the diabetes.
That, they're not alone. Definitely is a life change.
It can cripple your dreams of what you want to do in life. It can change your career path.
It could lead to something worse. So if you keep doing what you're doing, you might not be here.
It doesn't have to be that way. You can face it early on and take better steps than I did to control it.
I want you to take a look around and see if what you're eating and ingesting in your body is something that's really good for you in the long run, and that what you do at a younger age will have an effect as you get older.
So how do we reduce risk? Well, number one, this acronym, know your ABCDEs, make that work. So what does that mean? A is know your A1C, know your blood pressure, your cholesterol. Let's talk about diet. Exercise, and then to stop smoking, okay? Let's just jump into it. Let's go to A1C. So what is an A1C measure? Well, in a short way of looking at this, you have a red blood cell and you have a hemoglobin on that red blood cell. And if you look here, you'll see that top aspect is a good hemoglobin that tells us, oh, there's a little bit of sugar, it's doing its job, that's how it's supposed to look. Then if you look at the bottom one, you'll see more white specks in there. And that means there's too much glucose, and when there's too much glucose in there, there's less oxygen. Now we start having some, what we call as healthcare professionals, microvascular complications. We have less oxygen going to the places it needs to go. You might start having some numbness, pinpricking feelings like in your hands and your feet, your legs. You might notice your vision is changing. Some people have issues with their stomach, indigestion. You eat a couple bites of food and you notice you're full. And these are all signs that we are not getting the right amount of oxygen to the areas we need it. So how often should this test be done? Honestly, it really is about 3 to 6 months. 3 months if you're controlled, 6 months, or excuse me, 3 months if you're uncontrolled, 6 months if you're controlled. And then what is the goal? Roughly less than 7%, or it can be determined by your healthcare provider. If you have multiple comorbidities, if you have heart failure, AFib, COPD, high blood pressure, these are risks. And we don't want to make a very tight goal because then sometimes that can actually create more complications. So this should be discussed with your healthcare provider. And then why does your provider use this test? Why do we want this A1C? Well, number one, it's easy. Right, everybody, it's just some blood. You just go take some blood. But honestly, it really is a pretty easy test. You don't have to fast. You don't have to go 8 hours without eating. And it gives us a nice average over 2 to 3 months, okay? Knowing that the last month of doing your A1C, FYI, insider tip, the month before you do your A1C matters the most in determining what that number is going to be. Okay, blood pressure. Let's look at this. So what is goal blood pressure? Generally less than 130/80, okay? The goal blood pressure is to be 120/80. We say less than 130 because we can provide lifestyle interventions, right? And then when we start getting above that, then that requires that discussion with your primary care provider, your endocrinologist, to determine what is best for you. What medications help with blood pressure? Here's the slew, here's the gamut. We're not going to go into each of these because it really depends on what else is going on. You might have some sugar in your urine, you might have protein in your urine, you might have extra fluid on the body, you might have had a heart attack or stroke, or you might have an arrhythmia or AFib. And that's all going to be determined on what medication we're going to choose to maybe tackle more than one thing. So there's no wrong or right answer is kind of what I'm getting at. Now, when we're looking at blood pressure and you're checking at home, right? If you're just like, well, I just want to know what my numbers are. When is the best time to check? Well, usually in the morning or before your next dose of medication. If you're taking blood pressure medication twice a day, you should check your blood pressure before your next dose of medication. That's going to give you the most accurate reading to determine when your medication's kind of wearing off and then what are you normally running. All right, let's talk about cholesterol. All right, what is one of the most effective strategies to reduce your risk of heart disease when we're talking cholesterol? Statins. Well, I'm not going to go in the whole detail of how a statin works from a mechanism of action because it's kind of long and drawn out. But basically what it does is it helps decrease inflammation and homocysteine levels that then can decrease your risk. We know statins decrease heart attacks and strokes by 20%, death by 12%. And then we have all these names, right? So that's why we call them statin: atorvastatin, rosuvastatin, simvastatin, pravastatin, lovastatin. That way when your provider is talking to you about these medications, you have an idea that there's multiple. Well, my husband's on this, but I'm on that. So that gives you an idea there's more than just one that can help treat these symptoms. So when should you have a cholesterol lipid panel checked? Generally, 6 to 12 weeks after you start that statin, because that's how long it takes it to work. And then we roughly want a recheck every year. Sometimes if you're within normal range, if things are looking fabulous, you can go every 2. But that is determined between you and your provider and kind of what's going on, okay? When we're looking at diet, this is the big one, right? Diet, we're in the Midwest, right? So what diets have been proven to reduce heart disease risk? Number 1, tried and true, number 2, I should say, Mediterranean diet and a plant-based. So we really don't usually say a vegan because Twizzlers and Mountain Dew are technically vegan items. Looking at plant-based, we're avoiding the sugars, the additives, the processed foods, okay? Mediterranean diet and plant-based diet have been used as the basis of most scientific, I don't want to say projects, but your clinical studies, your clinical trials to prove if other diets work, if other lifestyle interventions work. These are your baselines. But we live in the Midwest, right? We are pretty much meat and potato people. I grew up in a family restaurant business of American food. I completely understand. You had meat, potatoes, a side of green beans, and a glass of milk and a roll, right? How can we better determine good choices with where we live? And I think that's an understanding of intaking whole grains. What does that mean? The whole grain. Cheerios is not the whole grain. Cornflakes is not the whole grain, okay? I'm talking about looking at old-fashioned oats, quinoa, looking at brown rice, things that have better fiber to them and they haven't been processed out, okay? We're talking about vegetables, fruits, legumes, healthy fats, and nuts. So healthy fats would be avocados, good cooking oils that withstand high heat, or drizzling, like your salad dressings. What specific food groups are targeted to help prevent this risk then? We have to look at the idea that there are foods that increase our risk of an event. It's out there, it's plain and simple, but we don't hear a lot about it. And that is trying to intake a lower amount of red and processed foods, okay? Saturated fats. Listen, I like a good meat and cheese board. But meat and cheese, salami, pepperoni, those are processed meats, so we can't eat them often. And then sugar-sweetened beverages, sorry, the Route 44, we have to make it a 20 ounce, just thinking how do we limit some of these. And that also includes like your Crystal Lights, your Diet Mountain Dews, your Diet Dr. Peppers. They're still sweet and they're still going to catch you on the backside, okay? When we're looking at fruits and veggies, everybody says, eat more fruits and veggies, they're good for you. Well, guess what? Fruits are sweet. We have to think about that. It has great fiber, but how much can we have? We need to look at more vegetables. I know, sounds lovely, doesn't it? 3 to 5 cups of fresh or frozen veggies a day, and really only about 1 cup or 1 piece. Or we look at, kind of the size of your fist. And if you are men and women with big hands, then sorry, it's half of a fist. So think about that, And that's really about 15, 30 grams of carbs. I'm not a big carb counter necessarily, but you do have to think about how much of these we're having. What else can we cut out? What else can we decrease? So we're thinking all the things that we're putting in, kind of food groups that help prevent our risk. And that is, if we have heart failure, if we have chronic kidney disease, right, we have some issues with the kidneys, you start hearing about, how much salt you're taking in. And this is, in general rule, about 1 teaspoon, which is 2,300 milligrams of sodium a day. We generally will say less than 2,000 milligrams. And if you are having issues with fluid overload, we'll say about 1,500. This is really found in a lot of your processed pre-made foods. You just got to turn it around and look at the label. That's the biggest thing you can do. And look at how many servings. So for example, ramen has 2 servings in it. I know, 2 servings. It's like 1,500 milligrams of sodium in 1 package of ramen. It's crazy. What else can we cut out? Thinking about cutting out the sugars, the fake sweeteners, we know that in essence, it may not necessarily change your diabetes, right? It says 0 carbs, but somehow you're not losing weight, somehow all of a sudden you're needing more insulin, and you're in this vicious cycle. These foods matter in the sense of creating more insulin resistance and then increasing your risk of heart disease. An unhealthy diet is actually linked to $50 billion of healthcare costs in the States, 20%. So if we took more time for our food, imagine what kind of impact that actually can have on all disease states, right? Okay, so we're gonna play a game. You don't have this at home, but we're just gonna do these pictures. So look at your handout, wink, wink. And we're gonna guess how many teaspoons of sugar in each item. So first of all, how many teaspoons are we supposed to have in a day? Well, men can have 9 teaspoons or 45 grams of sugar. So that can equate to carbs, but this is sugar, okay? Women, 6 and 30, and children, it's actually 3 and 15, okay? When we're looking at this, how does sugar impact diabetes and heart health, heart disease? We kind of just talked about it. I mean, we're going to increase weight, and we know that increasing weight increases our risk of an event. So think about this, a 20 ounce of Coca-Cola has 13 teaspoons. That is roughly 70 grams of carbs or 70 grams of sugar, right? We're looking at a Frappuccino. I mean, that's pretty much what a guy can have all day. And women and children, we've gone way over, right? Gatorade, 6.8. Now this is regular, this is not the G2, but like I said, these are not sugar-free diet, any of those. A Red Bull, 7.8. Your Tropicana orange juice, 6.6. The Dr. Pepper, it's a little less than Coke, 12.8. A vitamin water actually has 6 teaspoons of sugar, so 18 grams. Oh no, that's wrong, 30, excuse me. An iced tea, a Lipton iced tea, if it's sweet, there is sugar in it. So if you're doing plain tea, not a problem. A Monster Energy drink, which I'm just telling you, Red Bull and Monster Energy drink, I think they should have something in there about these type of drinks increasing your risk even more on top of diabetes for an event. All right, and then your juices, 9 teaspoons there. So you can see there's just the drinks alone cause you to go over on these amounts, right? That's kind of just the idea. I don't think we realize the impact that these have. All right, and the last couple things are exercise. How many minutes of exercise do we need per week? So 150 minutes a week of regular or 75s of vigorous, so if you're really getting out there and busting it. But that generally means 30 minutes a day, 5 days a week, but you could do 50 minutes a day, 3 days a week. You really only want to take 1 day off in between. Your body adapts really well, and it gets used, it goes back to its old ways. What types of activity are helpful? Basically, whatever it is, be consistent for at least 10 minutes. That gives you the heart benefits, okay? Doing 30 minutes plus gives you the weight loss benefits, okay, or muscle benefits. 2 days a week should be resistance. I'm not saying you have to go do free weights and give me 20 squats, but you might go do yoga, chair yoga. Build that strength, build that muscle mass. We lose 8% of muscle mass every 10 years over the age of 30. I know that was a long, drawn-out statistic, but resistance training matters. And when should you exercise? Honestly, it's in the morning, because sometimes if we go too late in the day, we get revved up and then you can't sleep. And now we're not getting sleep. And guess what tomorrow does when you don't get sleep? Your blood sugars go up. You're stressed out. But exercise is the #1 way to increase the good stuff. So that's the HDL, your high density lipoproteins. This good cholesterol takes away the bad stuff. So think of that. That exercise can kind of clean out the pipes, right? It can clean out those blood vessels. And then finally, we're going to talk about stopping smoking. And if you can see on this side, 20 minutes after smoking, if you wait, your blood pressure goes down. Your hands and feet get warmer. 8 hours, your oxygen levels go up. 1 day, if you stop smoking for 24 hours, that alone decreases your risk of a heart attack. I mean, that's huge. So I like looking at this timeline, but we know that basically smokers have a 30-40% higher risk of developing diabetes. So not only an event, but developing diabetes. And then we also know that they have that 50% higher risk of death, right? So I'm just going to give this so you have it, ksquit.org, Quit Now. A lot of insurances are covering options to stop smoking, from nicotine replacement therapy to Chantix to other medications. So talk to your pharmacist, go to the pharmacy and ask. You would be surprised how those resources can allow you and help you in being able to quit. And then in summary, know your ABCDEs, right? And then here are the questions to ask your providers when you do go to your next visit about how you can take charge of your health. You have more control than you think. And I hope this was helpful just to get a better idea of what your numbers mean, knowing your numbers. If you have questions, bring it up to your providers. And thank you for having me this evening. I appreciate it.
Thank you, Cassie, for that wonderful presentation. We'll finish with just a little bit of wrap up this evening. So if you have any topics you would like to us to discuss in our upcoming videos, or if you have any questions, please email us at diabetessupportgroup@srhc.com, and we will either address those with an email back to you, or like I said, add it to an upcoming video. We'd like to thank the SRHC Foundation. They provide financial support, and they really do help make all of this possible. And lastly, our next video will be in March. Look for our advertisements on the Facebook page and the SRHC website. Additionally, all our videos are posted there. And again, if you would like notifications or have any questions, please email us at diabetessupportgroup@srhc.com.